Your teeth don't fall out overnight. They warn you months in advance, sometimes years. The problem is, most people don't know what to look for, so they ignore the signs until it's too late. And by the time they finally walk into a dental practice, the simple fix is no longer on the table. In the next few minutes, I'm going to show you the 5 warning signs that your teeth are heading towards failure, what each one actually means, and exactly when you need to take action. By the end, you'll know whether you're still in the safe zone or whether the clock is already ticking. You've noticed something's off. Maybe a tooth feels different. Maybe you're avoiding certain foods without even thinking about it. Maybe you're quietly worried, but keep telling yourself it's probably nothing. That little voice in your gut is usually right, and ignoring it is what costs people their teeth. I'm Dr. Naresh Hirani. I've been a dentist for nearly 25 years, and I look after patients whose teeth are failing. I've seen these warning signs thousands of times. The patients who act early keep their options open. The ones who wait really do. In this video, I'm going to walk you through 5 signs your teeth are in trouble. Some you already know about, others you've probably been ignoring for years without realizing what they mean. Point 1. Your teeth feel different when you bite down, even slightly. This is one of the earliest and most ignored warning signs. A tooth that feels taller than others, a spot that catches when you chew, a feeling of pressure when you bite into something firm. These small changes matter. They usually mean the position or stability of that tooth has shifted. And that shift often caused by something happening underneath. Bone loss, cracked root, a failing filling, or a tooth starting to move because the support around it is weakening. Here's what most people get wrong. They think pain is the warning sign. It's not. The warning sign usually comes long before the pain. I've lost count of how many patients have said to me, I noticed it feel a bit weird around about a year ago, but I just got used to it. And then in a year, that's 12 months of bone loss, structural change, and a problem getting worse in silence. By the time it hurt, the simple solution was already gone. Think of a wobbly fence post in your garden. At first, it just feels a little bit loose. You ignore it. A few months later, it leans. A few months after that, the next strong wind brings it down. Your teeth give you a same sort of warning sequence. The early wobble is your window. Once you miss that, you're repairing damage instead of preventing it. Run your tongue across your teeth, bite down gently, and pay attention. Does anything feel different from how it felt about a year ago? If yes, that's your first signal. But there's a second sign most people dismiss as a hygiene problem when it's actually much more serious. Point 2. Your gums bleed when you brush and you decided that's normal. Bleeding gums aren't normal. They're never normal. They're a sign of inflammation, and inflammation in the mouth is the first sign of gum disease. Left alone, that inflammation moves deeper, starts breaking down the fibers that hold your teeth in place. Then it starts dissolving the bone. So the next time you brush your teeth, look at the spit in the sink. If you see any pink, any red, any blood at all, your body's telling you something's wrong, and don't wait for it to hurt. And that connects me directly to the third sign, because once gum disease takes hold, it triggers a problem almost everyone misreads. If this is making you rethink what you've been ignoring, hit subscribe. I publish videos every week to help you spot problems early and avoid the expensive, painful versions of them much later. Point 3. Food keeps getting stuck in the same place every single day. A tooth that traps food in the same spot day after day is not a fluke. It means the contact between the tooth and the tooth next to it has changed. And that change happens for a reason. Either the tooth has shifted, the bone has shrunk, the gum has receded, or a filling has broken down, or you've got a big hole. None of those are minor. They are signs that the structure of your mouth is changing. Here's what most people miss. The food's not the problem. The food's the messenger. And that message is something has moved. Patients tell me all the time, I just keep flossing that one spot. It's been like that for ages. Then I look at the x-ray, and that one spot is often exactly where the bone has dropped, the gum's pulled away, or a problem has been developing quietly for months or even years. Ask yourself these 3 questions. Number 1, is there a specific tooth or area where food gets stuck every single day? Number 2, has the way your teeth fit together changed in the last year or 2? 3, are you using a toothpick, floss, or interdental brush more often than you used to? If you said yes to 2 or more of these, you're not dealing with a hygiene fix. You're dealing with a structural change. And that leads me directly to the 4th sign. This one is so common that most people don't even notice they're doing it. Point 4, you've been quietly avoiding certain foods and you've stopped noticing. This is one of the most overlooked warning signs in dentistry because it happens so slowly. You stop biting into apples, cut your steak smaller, you avoid crusty bread, you skip the corn on the cob. Each choice feels small, but over time, your diet shrinks around the limitations of your teeth and you barely notice it happening. The avoidance is your mouth telling you something's no longer working properly and you've just learned to live with it. Let me put this bluntly. If you are eating around your teeth are already failing. You just haven't admitted it yet. I hear the same line from patients constantly. I can't eat properly anymore, or I avoid certain foods completely, but almost none of them come in because of that. They come in for something else. The food avoidance has become so normal, they don't even mention it unless I ask. Take 1 minute and think back over the last 3 months. Make a mental list of every food you've avoided, cut up small, or chewed only on one side. If that list has more than 3 or 4 items, you've already crossed a line. Your teeth are no longer doing their job, and it's time for a proper assessment. And that brings me to the most important warning sign of all, the one that tells you the window for the simple fix is closing fast. Point 5, you think about your teeth every day and it's wearing you down. Healthy teeth are invisible. You don't even think about them. You don't worry about them. You just eat, you smile, and you talk, and your teeth just work. The moment your teeth start taking up space in your daily thoughts, you've already crossed from fine to failing. It might be a low hum of worry. It might be a constant fear that something will break. It might be the embarrassment of smiling in photos, whatever form it takes. That mental load is a sign your mouth is no longer functioning properly, and your nervous system knows it before you do. Think of your teeth like a boiler in your house. When it works, you never think about it. The moment you start noticing strange noises or worrying whether it will last the winter, you know something's wrong. The worry itself is the warning. Your teeth aren't any different. Here's what I want you to do tonight. Take a piece of paper, draw 2 columns. In the first column, list every warning sign from this video that applies to you. In the second column, write down how long you've noticed each one for. If you have 2 or more warning signs, or if any one of them have been going on for more than 12 months, your next step is simple. Book a comprehensive dental assessment, not just a routine checkup. There's a difference. A comprehensive assessment looks at 3D scans, your gums, your bite, your bone, and what's happening across your whole mouth. Not just one tooth that's bothering you the most. Bring the list, hand it to the dentist at the start. That single piece of paper can change the entire conversation. Your teeth give you plenty of warning before they fail. The patients who listen early keep their options open. The ones who wait don't. Now you know what to look out for, which means the choice from here is yours. If you've spotted yourself in any of these warning signs, the next video to watch is the one I made about why dental work keeps breaking in the first place. It's the missing piece of this puzzle. Click on the video on the screen right now and I'll see you there.